Encik Azlan here.
Yeah. Hi, how are you?
Heading to CARiNG Pharmacy, right?
Yep, that's right.
Okay. Wow, balik from hospital, straight to pharmacy Why Here got no medicine
I'm just here to see the doctor actually, to get my prescription. It's more convenient for me to get my medicine from CARiNG.
Hey, but why more convenient? You have to go to 2 places, right? If it's me, I think I forgot to take my medicine already.
Oh, I use my health record in the CARiNG app. Everything is at my fingertips.
Wow, got such a one What does it do? Can you share with me more?
Oh, it's quite easy actually. Now, let me explain. My health record is an electronic record system that helps me record all my medical data, including the medication I'm taking. It helps me better manage my health because it allows the pharmacist to consistently review my medication. The doctor can also better understand my condition by looking at my health record. For example, they can check my blood pressure and blood glucose readings. So convenient, right? Saves the doctor time on looking for files too. Also, my health record helps to streamline my medical care between all parties. Don't worry, it is very safe and secure to keep all our medical data private and confidential. So many features, right? Hey, stop. We're here already.
Oh, let me find parking. I'll join you inside.
Oh, okay. Sure. Manage your health better with My Health Record. Like me. Sign up at your nearest CARiNG today.
Encik Amar, yeah?
Yeah, hi.
Wow, so many medicine
Yeah, need to stock up.
Huh? Then you should know about carrying My Health Record app. Come, I tell you.
Good afternoon, everyone. Thank you so much for tuning in to our Facebook live stream with Pfizer. I'm Pei Wen, a CARiNG Pharmacist, your host for today. The food situation in Malaysia is really alarming right now due to the heavy rain. I really hope everyone here is safe and sound. Please take good care of yourself. So today's session is going to be fun. Let's get started. Atrial fibrillation is a very interesting topic. I assume some of you might have heard of it before, but not sure what it's really about. Some of you might have never even heard of it, right? Do type 1 in the comment section if you agree with me. Oh, so we have Yvonne Chang here. And good afternoon. Yeah. So actually, atrial fibrillation is more common and serious than you think. As a pharmacist, I have come across with many patients and customers that find living with atrial fibrillation is actually a big challenge. Oh, thanks, Yvonne. Thanks for responding to my question. Yeah. So if you have any friends or family members who can relate to this topic, do let them know about this live stream right now. I repeat, this live stream right now because we are so glad to have an incredible specialist, Dr. Gary Lee, the consultant cardiologist and electrophysiologist at Thomson Hospital, Kota Damansara, here to share with us what atrial fibrillation is and how to manage it. Over the course of his career, Dr. Gary has been actively involved in the training of doctors in the field of internal medicine and cardiology at national and regional level. So, if you have any burning questions or concern about atrial fibrillation, do let us know in the comment box below. We will get Dr. Gary to answer them all. So now, please join me in welcoming Dr. Gary Lee.
Hey, hi, thanks, Pei Wen. Thanks for the
Hi,
kind
Dr.
introduction.
Gary. Welcome. How are you
Very good
doing?
afternoon to you. I'm good. It's,
Great. Did you actually affected by the flood and the downpour these few days?
well, thankfully, the hospitals that I'm practicing in, they are not. But in fact, we've also been trying to do some CSR work whereby we actually opening some of the unused ward to actually cater for people needing shelter as well, even in Thomson, Kota Damansara here. They can get the links actually and informations in the Facebooks of Kota Damansara Hospital Thomson. So we're actually doing that actually and trying to arrange something for people around that get stranded and things like that. Definitely, it's a very trying time, in the terms of pandemic. Yet at the same time, we have this flood issue. So I do agree with you. Everyone need to stay safe and sound, and of course be very vigilant and with all the informations are being carried down to us as well.
Yeah, I do heard that actually this is one of the worst flood in KL so far, in like KL or Selangor area, right?
Yeah, I think it's true. I have actually stayed in Klang Valley for quite a few decades. And this is
Mhm.
definitely something very extraordinary as well. Yeah, definitely.
All right. Okay. Doctor, you do stay safe, and everyone here, please stay safe and take good care of yourself. Okay. So it's our pleasure today to have Dr. Gary with us to talk about atrial fibrillation. All right. So Dr. Gary, as we all know, right, you are currently practicing at Thomson Hospital, Kota Damansara. So
Yeah.
would you mind to share with us, like,
Yeah.
how long you have been working here, and then your area of specialty?
Well, that's a very dangerous question because that will reveal my age. Age
There.
can also be a secret for a man as well. But just aside, I definitely has been practicing in the field of medicine more than a decade already. All right. And, of course, before joining Thomson Hospital, I've actually been working in one of the government main heart center as well. So yeah, and that is why it spurs my interest to join into this subspecialty of electrophysiology. So being a cardiologist, we deal with heart problems and things like that. But I sort of went into a bit further into it, into heart rhythm issues. So this makes me an electrophysiologist, and that is why the topic of today, heart to heart talk about atrial fibrillation, is something very close to my heart. It's something that I favor a lot. I like to talk about it a lot, and fall short of dreaming about it. That's all I'm saying.
Okay, thanks for the sharing of like how from the government hospital and then currently working at the private hospital. So, Dr. Gary, I think most of us are quite familiar with the term cardiologist. Okay, so it's like regarding heart, cardiologist, all these things, but we are not really familiar with the term electrophysiologist. So, Dr. Gary, what is actually a cardiac electrophysiologist?
Well, to answer that questions, right, I always give this analogy of a heart is just like a house, where you have water piping, you have the electrical circuit, you have the roof, you have the door, you have the window. So similarly, the heart also has its own water piping, where you see that, there's actually blood vessels that supplies the heart, giving it nutrient, giving it oxygens and everything. But of course, within the heart also, you do know that there's actually valve that opens and closes, very much similar to our house door and window as well. But at the same time, the essence of our heart actually lies in the electrical system. And this is a very specialized electrical wiring within the heart muscles itself that tells the heart how fast to beat, how slow to beat, whether it's beating regular or whether it's beating irregularly. So all this actually becomes a main play or main role of this electrical system of the heart. So when people ask me, what is an electrophysiologist, I always say that, I'm someone who wears two caps. So if you have, as a cardiologist, if you have water piping issues, you have blood vessels occlusion, blockages of the blood vessels, then I come in as a plumber. But when you have abnormal electrical rhythm, your rhythms becomes chaotic and things like that, then it comes in as an electrician. So I would say, I'm someone who wears two caps, and plumber and an electrician of the heart. So hopefully that gives us a bit of perspective, what an electrophysiologist is. So basically we also do what other cardiologists do, but we sort of specialize also in doing something that pertains to abnormal heart rhythm and things like that.
Okay. I think you put it in a very simple way that all of us can actually understand. So I actually saw a question from our audience.
Yep.
So she's actually asking what is. So now I think we should come to the main topic right now. So it's a time for us to explain to our audience in layman term what is atrial fibrillation. Yeah.
Yeah. Well, thanks, Selena, for that question.
Mm,
In fact, it is very important to know what is atrial fibrillation. It's all about because that's the main topic of our talk show today,
correct.
right? Isn't it, Pei Wen? Well, it's really basically atrial fibrillation is a problem that underlies the abnormal electrical system of the heart. If you can see, right, in a normal functioning heart where the electrical wirings are functioning normally, then when your doctors do an ECG, and ECG is basically an electrical recording of the heart, then you will see that, every beat from one heartbeat to the next heartbeat becomes very regular and the patterns looks exactly very normal. But if it's a time when this electrical system runs into a chaotic system, that's when you have a lot of misfiring of electrical signals. Very much similar to the analogy of a house where when you switch on the lights and the lights flickers. This is what our heart is going through. When the light flickers, signals are sent down to the heart system, so your heartbeat becomes very irregular. From one heartbeat to the next heartbeat, it changes. It can be fast, it can be slow. And so when you do a recording, let's say if I were to do a recording of 1 minute, I will see the heart rate will be changing from fast, slow, and this becomes very chaotic. And that itself is actually a heart rhythm disease of the heart because of an electrical system. So when your doctor tells you that you have atrial fibrillation, it is actually one of the many heart rhythm disease of the heart, actually.
So one of the many heart rhythm disease. Wow. Okay.
Yes.
So we can say actually there are a lot of heart rhythm disease. So
Yep.
atrial fibrillation, if let's say we put it in a simple way, can we say it's like a irregular heartbeat?
Yes, you can say that is irregularly irregular. We always call that. Yeah.
Oh, irregularly. Irregular.
Irregular. Yeah. Because it's so
Okay.
unpredictable, it's so chaotic, you see.
Okay. So can we actually explain to the patient or the customer, for example, your heart is like pumping like this?
Yep. All right.
Yeah. But it's not the very regular heartbeat, right?
Yes,
Yeah.
correct. Because it's basically there's a reason why the
Mm.
heart itself as a native conduction system that is functioning well, the heart is contracting at a very regular basis because bloods will come in very smoothly and blood will be pumped
Mhm.
up to the heart quite smoothly as well. But when this regularity of the heartbeats is absent, it becomes very irregular, become chaotic. Then the blood flow in and out of the heart will definitely suffers. And so when you look at the heart, for instance, we do have some scans, we can look at the heart in live motion. Then you will see like the heart is beating like a bag of worms like that instead of a normal functioning heart.
Okay, thanks, doctor. Very, very clear explanation and very interesting as well. All right, so doctor, I think all of us are keen to know what
Hmm.
are the causes of atrial fibrillation.
Yeah, well, that's a very interesting question, and I get asked this a lot of times,
Yeah,
not only in conferences lah, but also in the times, yes, when we had a chat with patients as well, they always ask, Doctor, you tell me I have an AF, but why do I have an AF? And then,
correct.
my siblings don't have it, and I'm the one getting it, you see. This is
Mm-mm.
something that runs in the family, and sometimes, I do have patients who are on the a bit elderly side, they will always ask me, does it happen? We're going to happen to my next generation as well. So all this comes into play. Well, generally to put it that way, there is many factors, many risk factors that predispose someone to getting atrial fibrillations. But one
Mhm.
of which, something very common, I always call the three uh, good friends. Number one is always hypertension.
Okay.
When you have high blood pressure, not well controlled, it's over the time, it's going to cause a lot of strains into the heart. Your heart start to go through what we call microscopic structural changes. And these microscopic structural changes will then affect the electrical wiring in the heart. And that will then lead to chaotic signals from the heart, electrical
Mm.
signal. So that's one of the most common cause of actually atrial fibrillation. Of course, having said that, there's other causes, for instance, diabetes itself. also causes heart structural changes, and that itself predisposed to electrical rhythms like atrial fibrillations. But of course, having said that, apart from this kind of what we call cardiovascular disease,
Mm-hmm.
other causes that may predispose you to atrial fibrillations, for instance, excessive alcohol intake,
Mm.
smoking, and all these are lifestyle modifiable risk factors which also can predispose people to atrial fibrillation. And of course, our good old friends of the heart, which is the lung, because the lung encompasses the heart. So if you look
Correct.
at the heart structure, right, you realize the left side and the right side of the heart is actually the lung. So the heart is and the lung are very closely related. So it means if you have lung problems, for instance, people with chronic lung disease like asthma,
Mm-hmm.
smokers' lungs, or they have something called a very peculiar type of condition they call obstructive sleep apnea because of breathing issues when they sleep. All these will cause lung changes and then it will also translate to atrial fibrillation. And last but not least, sometimes the heart problem itself also can predispose to atrial fibrillation. For instance, if you have valve problems within the heart chamber and that valve problems malfunction, it doesn't close well and things like that, it also can predispose to abnormal atrial fibrillation. Similarly, if you have water piping issues where your blood vessels of the heart gets blocked, itself will cause structural damage to the heart, and that again predisposed to atrial fibrillation. So there are many factors, that brings about atrial fibrillation, and your doctors will sometimes, look at your profile, look at you, assess you clinically, and do some tests, and then they will tell you, okay, this atrial fibrillation of yours, is it really related to some of these risk factors? But also, we do see patients without any risk factors. They get atrial fibrillations, especially young patients. And this is what we call lone AF or lone atrial fibrillation. So,
Lone
yes,
LON.
LONE. That's right.
Okay. So
Yeah, so
very
it's not something that
interesting.
happens in elderly people because people always have the misconception that high blood pressure happens in older people, not young people. But nowadays we see a lot of young patients. Don't you agree, Payment? I'm sure you
Yes,
see a lot of young clients, right?
true, true. And then I can say nowadays, right, they are about 25 years old and above. They do come in with very high blood pressure. They
Mm,
purchase high blood pressure medication, and sometimes when we do the blood pressure test for the customers, right,
yeah.
and then only we found out it's actually very, very young. The patient is like 30 or early of 30s. Mm.
Yeah, correct. That's very true. This is the new era we are seeing it.
Correct, correct. Yeah, so doctor, just now you did mention regarding the high blood pressure and
Correct.
then our diabetes, and also if you smoke a lot or you have lung problem, that all of these are actually the causes of atrial fibrillation. What about cholesterol?
Hmm. Well, basically, right, whenever you have this cholesterol problem, or
Mhm.
what in medical term we call this dyslipidemia, whatever you terms that your doctors may choose to tell you, it actually indirectly also does affects the heart because we do know that cholesterol issues can actually lead to coronary artery disease. As I mentioned, when you have blood vessels of the heart being blocked because of all these cholesterol sedimentations
Mm.
in the blood vessels itself, then that will again affect the supply of the heart muscles. So when your heart muscles doesn't get enough supply, it's
Mhm.
similar to a household which doesn't get water, then you're definitely going to suffer as well. So the heart will also go through a lot of changes, and then that can lead to heart failure, and heart failure also can runs into problems like abnormal electrical rhythm, like atrial fibrillation. So all these factors are very much interrelated. It can be a story of a chicken and an egg, whether the egg comes first or the chicken comes first, you see. But either way, most
Mm.
of the time, unfortunately, when we see the problems arising, becomes a bit more apparent to a lot of people. It is when things are actually getting a bit out of hands. Actually.
Mm. Okay, so doctor, just out of my curiosity, will like ethics or this kind of thing if you
Mm.
are black people or you are white people, because I do
Yep.
read some study, they
Mm.
do mention about this thing, will it actually be very
Correct.
mm,
This is what we call the social demographic, factors that
mm,
predispose someone to this kind of abnormal heart rhythm. Well, of course, there's always this questions about whether certain ethnicities,
Alright.
certain genders, certain age group that has actually more tendency of developing atrial fibrillation. What we do know for certainty, if we look at all these social demographic factors,
Mm-hmm.
one factor that plays a very important role of deciding one at risk of atrial fibrillation is actually age itself. So as we know, Malaysia is no longer a young country, almost coming to 6 decades of since independence. So we definitely have aging population as well. So age itself is a huge factor. If you have age more than 65 alone, without any other of all those factors we have talked about just now, your risk of getting atrial fibrillation is almost 2 to 3 times
Ah,
compared to someone of younger age, you see. So age alone is something that we will be a bit more vigilant to look at. So if someone elderly comes into me and complain about palpitations, the
uh-huh.
last thing I will be thinking is he or she is falling in love, you see. But I will be very concerned of them having an atrial fibrillation because of that.
All right. Thanks, doctor. That's really funny. All right. So now, after we know about the causes of atrial fibrillation, could
Mhm.
you please explain a little bit more about the
Mm.
complication of atrial fibrillation?
Yeah,
Hmm.
no, this is very true. If
Hmm.
any of your doctors, the moment they diagnose you with atrial fibrillation, they become a bit worried, and will be pondering, why is my doctor so concerned about this abnormal rhythm?
All
Well, having saying this way, most of the time when someone have atrial fibrillation, the only concern or the most important concern your doctor will have is in terms of getting stroke. So having stroke and having atrial fibrillations are very much closely related. Stroke, I always term this as a brain attack. Of course, people have always heard about heart attack. Heart attack basically talks about the blood vessels of the heart occluded, obstructed, or get a blockage. And that's where the heart doesn't get its supply. It runs into a problem. That's what we call heart attack. But similarly, our brain also can suffer what we call a stroke, where the supply going to the brain cells is being obstructed in many ways. Either there's a plaque that stops it, or there's a cholesterol sediment that blocks it, or
right.
sometimes the blood vessels actually can rupture on its own because the wall becomes so thin off because of a lot of changes and
Mm-hmm.
just bleed into it. Either way, the brain doesn't get its supply, people get stroke. The funny thing and something peculiar about atrial fibrillation is, if you remember, I was mentioning, atrial fibrillation causes a lot of irregular heartbeat. And this
Yes.
irregular heartbeat actually causes a lot of turbulence of bloodstream within the heart chamber. And I always like to use analogy as well, you see, Pei Wen. I always say, the stream of blood coming into the heart is just like a river stream. If the
Uh-huh.
river streams are pathway is very clear, the flow of the rivers are very smooth and doesn't look chaotic. But if someone were to throw a lot of pebbles on the river stream, you
Okay.
start to see the river stream becomes very chaotic. This
True.
is something very similar to atrial fibrillation. When the heart rhythm becomes so irregular, the contractions of the heart becomes irregular. There's so much of turbulence in the heart chamber, it forms tiny blood clots. And these tiny blood clots, if it goes up to the brain, it can actually obstruct the blood vessels of the brain and causes you to suffer a stroke. And sometimes to diagnose a stroke, it is not just the one-sided weaknesses that a lot of people know about it, or changes in speech that people come to know about it, or you find that a part of your mouth angles actually becomes a bit drooping down. But when your doctors do a CT scans like this, you start to see a massive stroke, a large area of your brain cells actually becomes occluded and they don't get enough supply and they start to die off. And I always say, brain cells are not as forgiving as the heart cells. So that's why we always say heart is very forgiving for that. So when brain cells start to get depletion of oxygens within the first 4 hours, if you don't open up, this is the time the brain cells will go into permanent damage. That's when you have residual weaknesses of your hands, your speech problems, sometimes comprehension, ability to think, and all this comes into play. So this is one of the most important consequences of atrial fibrillation. But of course, apart from brain itself, atrial fibrillation also can cause problems with the heart itself. You
Mm.
see, a normal heart is of a good size. We always say the size of our heart is like the size of our own fist, which is
Mm.
quite true to a certain extent, okay? So if you have a bigger fist, you tend to have a bigger heart. But when the heart becomes enlarged because of
Mm.
an atrial fibrillation, then it makes the heart having this ineffective contraction. the pump basically doesn't pump blood, doesn't circulate to the whole body. That's when you start to have heart failure symptoms. Sometimes you get people, the lungs flooded with fluid. Sometimes your leg becomes swollen. And sometimes tummy becomes distended because all these fluids are not circulating anymore. Everything backflows. It's just like a bank of river that backflows because of heavy rains and things like that. So all these becomes an issues with atrial fibrillation. The stroke because of brain attack or the heart leading to heart failure.
Wow, wow. Thanks, doctor. I love how you put all this together by using the stream, the water river, all these things. This is quite similar with what I used to explain to our customers in the pharmacy.
Yeah.
I will also use the same thing. It's like try to imagine your blood vessel is like a river, and then your cholesterol is like the sampah syrup in your blood vessel. All these things. So I think when we put all these things
Mhm.
in a simple layman word, then our customer or our patient will be easily to understand. All right. Thank you so much, doctor, for the very fun explanation. All right. So, ladies and gentlemen, a gentle reminder to all forget to answer the question pinned at the comment box below and stand a chance to win 50 ringgit CARiNG Cash Vouchers. If you pay attention to what Doctor mentioned just now, right, you will be able to answer this question. So, what is this question? Is atrial fibrillation associated with the heart attack or stroke? Don't forget to hashtag CARiNG Pharmacy and Pfizer along with your answer. We will then select and message the winners with the most accurate answer after this session. You can
Can I
also
answer the question? Okay.
give the chance to others, okay? Okay, so you can also like, share, and tag 3 of your friends to increase your winning chance. So now back to our main topic, doctors. Pardon me. All right. So, what are the signs and symptoms of atrial fibrillation before we get the stroke, our brain stroke, and our heart stroke? Yeah.
So I think that's a very relevant question because a lot of times, if someone were to have a heart attack, the most important and most apparent symptoms is a chest pain. And that will quickly, alert someone and they probably rush to the next hospital, the nearby hospital and get themselves treated. But unfortunately, atrial fibrillation tends to be a bit more subtle. So whenever electrical rhythm problems with the heart, when it presents a bit more subtle, people tend to ignore it. And one of the most common symptoms of atrial fibrillation is actually palpitation. You may feel your heart is racing for no reasons, for no apparent reasons. You may be seated down, rested very well, not looking at any horror movies, not reading any interesting news and things like that. But yet suddenly you feel your heart is thumping away. This
Mm,
is the time, it probably rings a bit of alarm that something is very wrong
okay.
because our heart doesn't beat fast for no reasons, you see, unless the brain tells it so, you see.
Okay. Okay.
So if there's unprovoked sort of a palpitation, this is the time you probably want to be a bit more concerned of. Was there something abnormal? It may happen very transiently, for 1 or 2 seconds. Like, for instance, you just sit it down for a few seconds, you feel that, and it goes away, and it never comes back until months and years later. So this is the time, people tends to ignore as well. But of course, sometimes atrial fibrillation, when it sort of progress on, so it's really like a disease that progress on in a spectrum. When it's mild, you probably have 1 or 2 symptoms, very transient. But as it progress on, then symptoms become a bit more florid. You may start to have chest discomfort. You may start to have breathlessness. Sometimes, you may start to have this, what we call giddiness as well, or fainting spells as well. Yeah. So then people become very much alert to it and then they will get themselves checked in and things like that. But these are so-called fortunate people, Why do I say fortunate? Because you have so-called mild symptoms and it brings you a bit of alarm and then you get yourself checked out early on. But there are some people, they are a bit unfortunate. The first time they have symptoms is the time when they really get the complications of atrial fibrillations,
Uh-huh.
either a stroke or a heart failure.
Oh, wow.
And then when they come into the hospital, doctors check and they decide, oh, you have atrial fibrillation causing you to have a stroke, or atrial fibrillation causing you to have heart failure. So that time, at that juncture, the management becomes a bit more complex. Then the outcomes are definitely not as favorable as it should, you see. So therefore, symptoms are a lot, but it is picking on those symptoms and getting yourself alert about it, and picking out on that and do something about it. That's the one where it really matters actually.
Okay, so it's actually based on patient themselves or we ourselves to be alert on all these mild symptoms. For example, just now, like you mentioned, even giddiness or
Yes,
short of
correct.
breath. Yeah,
Yep.
because most of the people they will just say, I just have some burning like that. There's not a big deal. Yeah, correct. So you might have atrial fibrillation, right?
True, correct. And sometimes, we tend to trivialize our symptoms to a certain extent, to exhaustions, anxiety. And
Correct.
as in the course of being an electrophysiologist, I always come across people, whenever they come with palpitation, the first
Uh-huh.
question they will always ask me will, Doctor, am I having anxiety?
Yeah,
That's
true, true.
correct. They will never ask me, Doctor, am I having heart problem first? Because anxiety and of course panic attack is something that people are so aware of it. It
Mm,
becomes being talked about and things like that. Yes, it is very true. There are certain extent palpitations are related to anxiety and all this, but
mhm.
it's always very important to exclude heart issues first before we put a label of someone having anxiety.
All right. Thank you. Yeah, because sometimes when we measure the blood pressure for the customer in the pharmacy, right, they
Yeah.
will say, oh, yeah, last night I didn't sleep well. Or I have
Correct.
a little bit of uneasy under the
Uh,
weather. That's why my
correct.
pressure is a bit high. So I think the same thing goes to what you mentioned just now.
Or is it we are seeing the white coat hypertension?
True, true,
Pharmacists and
possible.
doctors wear white coat, brings pressure goes up. Well,
Correct. Yeah, so now we have know about the sign and symptom. So most of our viewers here might be very interested to know how can we actually check for atrial fibrillation. Let me show you something unique.
here's
So
some gadget, is it?
yes, ta-da! So what is this? This is actually a device we call Cardia Mobile that we use in the pharmacy to help our patient or our customers to check if you have atrial fibrillation. Let me show the yeah. Okay, so doctor, maybe you can talk more about this.
Yeah, it's actually a very unique device, and in this device actually been around for many years already. And you see what when Pei Wen is holding on it, it's actually a very slim device,
Correct.
correct? Even slimmer than your smart phone, right? Correct.
Yeah. Very
The
small.
Yes, correct. The purpose of this is actually to allow you to record an ECG, an electrical rhythm on your own, and you can actually link it to an applications in your smartphone as well. So once you record it, you can even send it and email it to your doctor, because in the era of health digitalization, we get a lot of patients sending to me, once they recorded some ECG, because when they have palpitations, they send to me ECG, and the ECG actually recorded some abnormal rhythm. Then I can tell them, oh, this is something that you need to come in to see me now. It's something dangerous, something worrying, and things like that. So this is a device that allows and has changed how we diagnose atrial fibrillation. In fact, this device is actually a medical grade device that is actually giving you a very accurate recording in terms of the electrical rhythm of the heart as well. So, in fact, a lot of my patients, they have gone through extensive investigations in and out hospital, yet
Mm-hmm.
the palpitation seems to come again and again. And it always comes at the time when it's midnight, when the time they are driving, when the time they are not near their doctors. This device will give them a good venue for actually record the ECGs and get into the doctor's concern for them to make a diagnosis of whether they have abnormal heart rhythm or not. It has really changed how we diagnose atrial fibrillation in this context.
And I believe this really helped, right?
Yeah,
In fact,
correct. That's
yeah,
true.
this really help. So, ladies and gentlemen, if you would like to have a checkup, can always visit the participating CARiNG Pharmacy to get a free consultation from us, pharmacists. Out of 156 stars, we have 50 CARiNG Pharmacy all around Malaysia with this Cardia mobile device, and we are able to provide this service to you, okay, to check your atrial fibrillation. Yeah. So, doctor, except this cardiac mobile, is there any other way that we can check for atrial fibrillation? If let's say patient is not able or not convenient to come to
Yeah.
caring pharmacy to check. Yeah.
Well, conventionally, as I mentioned to you that, most of us in the medical line, when we make a diagnosis of atrial fibrillation, we actually use a device, we call this the ECG machine. So
Mm-hmm.
basically, ECG machines, as those who have undergone an ECG test before, you have a lot of wires being hooked up on you on the chest, and it allows the doctor to actually look at the rhythm itself. And we look at the ECG tracing, which I always tell people there's actually 12 alphabets and numbers here. The reasons are it actually looks at your heart from a 360-degree view. So it gives us a bit of idea of how the heart is functioning, whether there's abnormal problems, abnormal heart rhythm. Like as illustrated here, this patient had a very chaotic heart rhythm. Sometimes it's fast, that's why it's closer, the peak to peak. Sometimes it's further away, that's why it's a bit slower. But definitely this patient is having an atrial fibrillation. So ECG has always been the gold standard of how we diagnose atrial fibrillation. But then it comes in with some smart devices like we shown to you, Cardia Mobile. There's also some devices like some smartwatch which has ECG recording purposes or features. That has actually really changed of how we sort of diagnose atrial fibrillation as well. But there are times ECG also has its limitations because ECG at the very most you can record it for 10 seconds to 2 minutes or 3 minutes as you would want to be. But there are times, patients when they have these palpitations or when they have atrial fibrillation, it may occur at the timing which is very awkward. For instance, when they're at night time, when they are resting or when they are sleeping. So this is a time we actually do something what we call a Holter monitoring. Of course, a Holter monitoring is just like an ECG monitoring, but it's over extended period. You can do anytime from 24 hours up to 2 weeks of duration of continuous monitoring. So
Okay.
it's as though you are being in a hospital, being monitored, but the only differences is you are walking around at home, going to work, doing what you want, and you can go on with your daily activities. But yet we have continuous recording of your heart rhythm and your heartbeat as well. So this has actually also become one of the tools we use to diagnose atrial fibrillation. Having said that, sometimes we also go in and actually go and do what we call an ultra, very specific form of procedure where we put in this kind of very tiny devices. This
Mm-hmm.
is magnified already, so it appears big, but it's actually very much like our pinky finger only the size. We will actually put it underneath the skin. We make through a very small nick through the skin, put it inside, and it actually can continuously monitor your heart rhythm for the next 3 years to come. And the very interesting thing about this kind of implantable loop recorder, which is being implanted by many of us electrophysiologists, is can actually communicate with the home monitoring device, and everything will be downloaded to the server, and your doctor can actually remotely from apart. You don't need to come to the clinic. They can actually remotely monitor and look at your heart rhythm. And this device will also send off alert to your doctors and say, "Oh, I pick up atrial fibrillation. Please get the patients back and review the patient," and things like that. So this has been some of the tools that we use as an electrophysiologist to diagnose atrial fibrillation. Last but not least, sometimes we also do what we call an echocardiogram. Basically, it's an ultrasound scan of the heart, allowing us to visualize the heart itself, to look at whether the heart has heart failure or not, whether there's valve abnormalities or not, looking at the heart in motion itself. So these all are some tools, some basic tools for how a cardiologist or an electrophysiologist will make a diagnosis of atrial fibrillation and look at whether atrial fibrillation has caused any forms of heart failure or not. Right?
Okay. So, doctor, just curious, the
Holter monitoring, correct?
Holter monitoring, is that a very small device to put on our body or?
Yeah, in fact, it is actually something very miniaturized. Nowadays, we have Holter monitoring devices, which is just a patch. And I always say it looks like a boomerang patch with a tiny
Oh,
littering device there. And it's waterproof. You can bathe while put on it.
uh-huh.
You don't have to abstain from from any bathing and things like that. But basically, it allows you to continuously monitor the patient's heart rhythm, and you will do it very silently at the background. So this is something very unique, and it doesn't disturb you. And whenever you are put on your clothing and things like that, hardly noticeable in most contexts.
Interesting, interesting. This is really my first time access to all this information, Dr. Jerry.
So electrophysiologists have a lot of tools to play with actually. So
Correct, correct. So now I think now all viewers are quite concerned. It's like, what about the treatment? Okay,
Yeah.
what are the treatment options for patient diagnosed with the atrial fibrillation? Actually,
Mhm.
Dr. Gary, we received a question from Miss Lisa Chong. So, can
Okay.
atrial
Hi, Lisa.
fibrillation be cured without medication? Let's answer this question first.
Okay. Well, I think basically that's a very, very interesting question,
Mm-hmm.
because atrial fibrillations, it is a spectrum of disease. You
Mm-hmm.
can have something that comes in as a mild early stage. You
Mm-hmm.
have someone who comes in at a moderate or mid stage, or
Mm-hmm.
someone who comes in with late stage or severe condition. In most contexts, right, when atrial fibrillations in clinical context, when we see them, they actually already most of the time at the middle or towards the severe stage, because it's the time when they have more symptoms, and that's the time when they become more alert about it and they come to see a doctor. To cure atrial fibrillations, basically you need to be dealing with someone who is at an early stage.
Mm.
Then your outcome, your success rate of rendering them back to a normal heartbeat will be higher and more sustainable. I will not say, we can offer a cure, but if you come early enough and you treat the problems right up front, then you probably can get these problems, end remission. In remissions in medical terms means preventing it from recurring again. See?
Mm-hmm.
So, and I always have to use another analogy. It is just like when you plant a tree saplings and you don't like the tree. You find this tree is awful looking. You probably want to uproot it when it's still young tree. When you uproot it when it's a big tree, the root is deeply seated. The problems is even more difficult to treat actually. All right. So I hopefully, to answer Lisa's questions, I think to cure atrial fibrillations really depends on when you are being diagnosed with it, and the treatments rendered to you also has its different success rate as well. Of course, having said that, most of the time when we look at atrial fibrillation management, we
Mm-hmm.
can talk about medications. We do have a lot of medications, and I'm sure Pei Wen, you as a pharmacist, you have come across all these medications that deal with atrial fibrillations
All
itself.
right.
If you come early enough and the prognosis is good, and we want to make sure that you don't get recurrence of atrial fibrillation itself, sometimes the doctors will prescribe medications that make sure you are always remains in a normal heartbeat. But if you come at a very late stage, where it's very difficult to get back a normal heartbeat, your heart has become dilated and things like that, then we can even put you on some medications to make your heart slow down, don't beat too fast. Because whenever the heart beats too fast in atrial fibrillation, so chaotic, your heart gets a lot of strains, the heart muscle suffers, you get more complications as well. There are also times we actually put people on blood thinner because, as mentioned, some of these turbulence within the heart chamber form tiny blood clots. So if you put them on some blood thinner, so despite the turbulence, the blood will not form clots within the heart chamber that will lower the risk of atrial fibrillations. But ultimately, again, electrophysiologists also have many tools to play around to treat patients with atrial fibrillations. So what we do is we sometimes do something we call ablations. And I always say, it's a method of fire and ice method. For
Mm.
instance, if patients have this abnormal heartbeat, and this abnormal heartbeat is because of an electrical abnormality in the heart chamber, sometimes electrophysiologists like myself, we can actually put in a specialized wire like this within the heart chamber, localize where is this abnormal circuit is, and burn away this abnormal circuit. So it is very much similar to get an electrician to come and look at your TMB fuse box and look at the wires where has gone wrong, where has it tripped, and rectify the problems as well. We can do this by burning it away, or sometimes in our context, we can actually do what we call using a cryoablation, using a liquid nitrogen that brings down the temperature to negative 45 to 55 degrees Celsius and actually burn away this abnormal circuit. So it's really a fire and ice method that we can do to actually render a patient's in a normal heartbeat instead of going into atrial fibrillations. So these are some of the methods of how we treat patients with atrial fibrillation, medications or some procedures we call ablation itself.
All
So
right.
maybe that will give us a bit of perspective on how a heart doctor manages atrial fibrillations.
Okay, okay. Thanks, doctor. Yeah, Lisa do ask about if let's say they cut down the caffeine, which is
Correct.
not regarding the clinical side. So what
Mm,
are some of the like uh daily routine that our customer and our patient
mm,
can do to
mm.
reduce the chances or at
Uh,
least yeah,
okay. Well, I mean, at the end of the day, we're talking about prevention, right?
prevention, yeah.
Yeah, I always say that prevention is always the key to treatment.
Mm-hmm.
If you prevent something, then it probably helps you to avoid from getting atrial fibrillation or any heart related ailments. But unfortunately, for atrial fibrillation, if you're talking about taking certain things, certain supplements to make you having lower risk of atrial fibrillation, well, we do not have conclusive evidence for that. But we do know that there are some measures we can do to sort of modify to lower the risk. Although the risk cannot become zero altogether, but we can do something to actually reduce that risk itself. For instance, abstinence from smoking and alcohol is one of the modifiable risk factors anyone can be able to do. You smoke one less cigarette butts, you drink one less glass of alcohol, it's probably going to translate to a better benefit than an addition of that. Of course, the other thing that you should probably be want to be on the lookout to prevent atrial fibrillation is to go for health screening to look for medical problems that may predispose you to atrial fibrillation. For instance, diabetes always happens very silently, right? Isn't it, Pei? And
Yeah.
there are sometimes in yourself as a community pharmacist, you do help them to do some random sugar check as well. This kind of random sugar check will pick up real diabetic patients, which if you treat it early, then you can potentially prevent cardiac or heart related conditions related to atrial fibrillations or diabetes itself. And sometimes as a community pharmacist also, you do help them to do some routine blood pressure measurement, isn't it?
Oh, yes.
This is also helping us to pick up those silent high blood pressure patients, which, if not well treated, also can predispose to atrial fibrillation. So, in that context, to sort of sum it up, if you can prevent yourself from getting the risk factors that predispose you to atrial fibrillation, you probably are one way of actually reducing a risk of getting atrial fibrillation already.
Yeah. So what we can do is a frequent checkup
Yep.
so that we know our body well. And just now, Dr. Gary Dean mentioned about our healthy lifestyle. For example, the diet, the supplements, all these things. So we have one question actually from Royston Chong. So
Okay.
he asked, is beta glucan can
Hmm.
prevent heart disease and cholesterol problem? Yeah.
I wouldn't say it's used for
Mm,
prevention, but a bit of disclaimer, I'm no expert in nutrition and
mhm,
supplements itself. But we do know that there's even about beta glucans itself, we're talking about fish oil itself, we're talking about
mhm,
Q10 itself, and all these kind of
mhm,
so-called heart-related supplements. Well,
mhm,
at the end of the day, I will always tell my patients there is no harm in taking them. All right. But
mm,
there's always very important to remember this is not the only way to prevent heart disease. There's many other methods as well that needs to go hand in hand apart from taking all these supplements and all these so-called dietary intakes of heart preventive medications or things like that. So it is very important to make it hand in hand whereby you go along with lifestyle modification. You have
mm,
someone who's sedentary who doesn't do exercises, who takes junk foods and they don't watch their diet. But at the same time, they'll be taking a lot of fish oils, beta glucans, and all this. But that does not translate to reduction of heart disease as well. So when it goes hand in hand, then you're probably going to benefit more. But when it doesn't, when it's on an isolation, you just go on one method, you're probably not going to yield much benefit at the very end of the day. So
true,
hopefully,
true.
Royston, I answer your questions directly or indirectly.
Yeah, and then now because I mean previously because of MCO, actually a lot of customer and patient gain weight. And then
Mm,
after the MCO has been lifted,
mhm,
right? Many actually come to pharmacy and then ask us like how to lose weight. I have gained 3 kg, 5 kg during the MCO, all these things. Right. So COVID-19 actually um, badly affect all of us. So talking about COVID-19, doctor,
mm.
what is the relation between the COVID-19 and also the atrial fibrillation?
Well, that's a very interesting question as well because why? Actually, do have a lot of patients whether they have COVID-19 infections itself, at the time of infections, they get abnormal heart rhythm. But we also start to see that, there are patients who, after COVID-19 infection, they recovered. They start coming to us complaining of palpitations. And if you look at one or many of the studies out there, in fact, a lot of studies has been carried out, we do see that atrial fibrillation is one of the most common abnormal heart rhythm in COVID-19 infections itself. The reasons behind it, we are not sure why, because this, again, COVID-19's knowledge is evolving as we talk now, and more informations and more research are being done by itself. But we do see one trend is that whenever someone is down with COVID-19 infection, pre or post, we tend to see that they do get a lot of heart problems. And one of the most common heart problems, as I mentioned, is atrial fibrillation itself. So whenever an atrial fibrillation patient starts coming to us, our management of them will be very much similar to a non-COVID-19 patients as well. It is still going through the whole same concept of profiling the patients, knowing what stage they are in, whether any complications has set in or not, and then deciding what is the best management strategy for their abnormal heart rhythm. So it is very much interrelated. As I mentioned to you earlier as well, the heart and the lung is really sitting close by together. So whatever happens to the lung is definitely going to affect the heart to a certain degree. And this is one of the studies that has shown lung infections are translating to abnormal heart rhythm as well.
Oh, okay. I didn't know actually lung infection can related to our heart disease as well.
Yep.
Today is really open my eyes, open my ears. to,
It is actually very common, we see a lot of infections which we think it's just a lung infections. They turn out to have a lot of heart complications as well. And that is why, whenever you have problems, you don't nip it in the bud, the other problems will start to set in as well.
All right. Thanks, Doctor. Thanks. So before we move on to the Q&A session, let me remind all of you again, don't forget to answer the question pinned at the comment box below to stand a chance to win the 50 ringgit CARiNG Cash Vouchers. 50 ringgit, you can buy a lot of stuff. So the question is atrial fibrillation associated with the heart or stroke, a brain stroke? Okay, so don't forget to hashtag CARiNG Pharmacy and Pfizer along with your answer. We will then select and message the winners with the most accurate answer after this session. You can also like, share, and tag 3 of your friends to increase your chances of winning. Okay, so Doctor, now it's come to the fire and ice session. You need to answer some of the interesting questions.
I hope there won't be some tough questions.
Okay, let me see. Is there any interesting questions?
I think there was one question which was very interesting just now,
Uh-huh.
is atrial fibrillation heart attack? I think that I will probably want to take on that questions, because it's a lot of misconception, a lot of misunderstanding by
True.
not only just by people out there, but even within the medical fraternity itself. Well, basically put it that way.
Ah.
I always say heart attack. It's a water piping issues. Your blood vessels gets occluded. This is what we call heart attack. And that is a time where your heart suffers because they don't get oxygen. They call out for help, and you get these symptoms of chest pain. You need to rush to the hospital. Your doctors probably will suggest you for an angiogram, which is a procedure to look at the blood vessels condition and probably do some ballooning and stenting, which people have heard a lot about it. But when you have atrial fibrillation, all right, or when you have abnormal heart rhythm, one of them was asking about VF. I think we do have a lot of very well medically knowledgeable audience here today.
Yeah.
When this kind of abnormal heart rhythm, it gives rise to problem and causes someone to collapse suddenly. This is what we call a cardiac arrest. It is a very different from heart attack. Cardiac arrest means the heart stop and it's actually an electrical problem. It's just like your house suffer a blackout when the electricity doesn't come into the household at all. So these two actually are two different entities. When you have a cardiac arrest, this is a time where you probably want to do some procedures to bring the patients back again. That's why you see it in movies or dramas or even in real life news. People start to put them on a specialized machine, which we call a defibrillator. and actually shock them out of and get the heart starting back again. So this is what we call cardiac arrest related to heart rhythm issue. So AF is not heart attack. AF is a heart rhythm problems, and it's actually something that is related to the electrical system of the heart abnormality. So hopefully that will give a bit of clear explanations to our audience out there. What is a heart attack and what is a cardiac arrest itself.
So now I think most of us have a better and clearer picture. So I think this question quite interesting as well, Doctor,
Okay.
from Miss Elena. So
Alright.
she asked, some dermatitis, right, is related to blood that cannot circulate well. So anything related to heart physiology, dermatitis related to heart physiology.
Okay. Well, basically, with dermatitis, basically, we are talking about issues with the eczema. So eczema basically talk about inflammations of the skin layer. And you know, skin is actually the largest organ in our body, actually. All right. Not the heart, not the liver, not the lung, not the brain. Well, of course, at the same time, when we talk about eczema, there's many reasons for eczema. Sometimes it is what we call related to internal organ problems presenting with skin manifestation. But there are also times skin manifestation itself is a standalone. There's no internal organs problems. For instance, I'm just going to throw an example. All right, if you are allergic to detergent, allergic to soap or certain chemicals, and you get in contact with them, you get this contact dermatitis or irritant dermatitis. This is what we call in medical terms. It is actually not really because of inability for the blood to circulate. That's why you get this kind of inflammation of the skin layers. But it is actually because your body sends this kind of so-called foreign body, and it starts to launch an attack on this foreign body. So your white cells comes in, your all these very peculiar inflammatory cytokines, we call this, armies of your immune system starts coming and start to try to attack this foreign body, and the collateral damage will be your skin. Your skin becomes red, peeling off, inflamed, painful to touch. Sometimes you get blisters and things like that. So this is actually dermatitis underlying mechanism. So it's not because the blood are not circulating. In fact, the blood circulates. That's why your armies of immune system reaches the skin layers. All right. Whereas when you talk about heart ailments, it is more related to inability for the blood to circulate. That's why it gives rise to heart problem. For instance, your blood vessels of the heart doesn't get its supply because there's an occlusion. Blood doesn't circulate to the heart muscle. You get heart attack. Your heart failure sets in. Your heart can't pump. So blood going out of the heart becomes poorly circulated. Therefore, you become breathless. Your lung oxygen actually depletes and things like that. So heart ailments, yes, it's very related to blood circulation, but skin issues, dermatitis, are not really related to the blood circulation. Right? So hopefully that clears a bit of introduction.
That's why I say this is a very interesting question when people ask about sensitive skin, dermatitis related to the heart issue. All right, so doctor, thank you so much. I think that's the end of the sharing session because of the time constraints. So to the viewers who are joining halfway, remember to answer the question pinned at the comment box below because you might stand a chance to win the 50 ringgit CARiNG Cash Voucher after this session. So this is the question. Is atrial fibrillation associated with a heart attack or stroke? Okay, hashtag CARiNG Pharmacy and Pfizer along with your answer. So we will select and message the winners with the most accurate answer after this session. You can also like, share, and tag 3 of your friends to increase your winning chance. All right, so before we end our session, Dr. Gary, just a quick and a short one. Any take-home message for us?
Yeah. I actually have a wonderful time here. Time really flies. I think very important key home message to our audience here today is prevention is always the best compared to treating patients with heart ailments. Because sometimes when we see patients treating with heart ailments, it's probably at the time when it's a bit difficult to reverse the damage. So I always tell people around me, it is the time when you start to have subtle symptoms. Get it checked out, get it sorted out, and get it diagnosed early so treatments can be rendered early. Then you potentially be able to prevent catastrophic conditions from setting in. So with that, thanks a lot for staying tuned with us today. And thanks to Pei Wen for being a nice host today as well.
Thank you so much, Doctor, for the compliment, and thanks everyone for joining us today, especially Doctor for spending your wonderful Sunday with us for the insightful sharing. Thank you so much. Thanks. And don't forget, everyone, to like our Caring Facebook page and share this video with your friends and loved ones. I wish all of you an amazing rest of your day. Have Merry Christmas in advance and Happy New Year. Bye bye.
Bye.